Okay, well, why don't we go ahead and get started. Thank you all for joining the last education call for the year, and a great way to start out the month of November on diabetes basics. As November is Diabetes Awareness Month, we like to try to present this information yearly to inform you all who may currently have diabetes in conjunction with kidney disease, and to sort of spread awareness of the fact that diabetes is one of the main precursors and causes of kidney disease. And we're very grateful to have Wendy on the line from the Delaware Division of Public Health Diabetes and Heart Disease Prevention and Control Program. What a mouthful.
Yes.
And so Wendy, if you're ready, feel free to take it away.
Why, thank you very much. My name is Wendy Bailey. I am the state coordinator for the Diabetes Self-Management Program in the state of Delaware, and we offer self-management workshops for our constituents in Delaware for free, and we'll talk more about that at the end of this presentation. So today we're going to talk about diabetes basics, and we're going to start with, there are 3 common types of diabetes. Type 1, that's usually diagnosed in children or teens or young adults. It's a type of diabetes where no insulin is produced by the body, and insulin must be given in order to sustain life, and this affects about 5 to 10% of the people with diabetes. There's also type 2 diabetes, which occurs when your body is resistant to insulin or doesn't produce enough insulin. This can happen at any age, but usually more in the older adult population. And then there's gestational diabetes, which develops only during pregnancy, but it increases the risk of developing a type 2 diabetes later in life. Who's at risk for diabetes? Well, the risk factors for diabetes include older Americans, age 45 or older, anybody that is obese, people who are 120% of their recommended body weight or above, anybody with a genetic connection to diabetes, relatives, parents, children have diabetes, and some of the minority populations, Native Americans, Latinos, Asian Americans, and African Americans have a higher prevalence of diabetes in our population. Some more risk factors include women who have had gestational diabetes or given birth to very large babies, 9 pounds or more, people with high blood pressure, people with low good cholesterol and high bad cholesterol, and individuals who have an impaired fasting glucose or impaired glucose tolerance, and those are both blood tests measured. How do you know if you have diabetes? Well, some of the signs and symptoms are an unusual thirst, a need to urinate frequently, an unexplained weight gain or weight loss, blurry vision, feeling very tired, experiencing flu-like symptoms without having the flu, slow healing of sores or frequent infections that are also slow to heal, a numbness in the feet, the fingers, or the legs, red, swollen, tender gums, drowsiness. Of course, if you're measuring your blood, you might see it in an elevated blood sugar, and you might experience something called acanthosis nigrus, which is a darkening and thickening of the skin, particularly wherever skin touches skin. So back of the neck, under the chin is an easy place to spot that. How do you get a diagnosis of diabetes? Well, diabetes is diagnosed with one of 4 different blood tests. They include a fasting plasma glucose test, an oral glucose tolerance test, a random plasma glucose test, and an A1C test. All of these involve measuring the amount of sugar or glucose in the blood. What determines if you have diabetes? If your fasting plasma glucose levels, meaning you haven't eaten for at least 8 hours before you have this blood test, are above 126, then you have a diagnosis of diabetes. If they're between 100 and 125, you could be considered pre-diabetic or at risk for having diabetes. And if they're below 99, that's considered normal. Some of the other tests that measure are the oral glucose tolerance test and the A1C. The A1C measures the blood sugar amount in your blood over a 3-month period. Gives you a random, an average level. A normal A1C would be about 5. A diabetic A1C test would be 6.5 or above. And then the oral glucose tolerance test, if you're 139 or below on that measure, milligrams per deciliter, you would not be considered diabetic at all. Between 140 and 199, you might be considered a pre-diabetic. At 200 or above, you would be considered diagnosable with diabetes. All right. It's really, really important to keep your diabetes under control. There are complications that come from having diabetes, and having diabetes over time without keeping your blood sugar levels under control can cause some devastating complications, including blindness, kidney failure, heart disease or stroke, amputations, dental and gum disease, high blood pressure, risk at birth, nerve damage, skin infections, death from pneumonia or influenza. The way to keep your diabetes under control is the key to preventing or delaying these complications. Your diabetes medication as prescribed, either the pills or the insulin, usually given in a shot, exactly the way your doctor recommends. Monitor your blood sugar daily and keep a record of that. See a certified diabetes educator and make a plan for keeping all of the healthy habits going and the blood sugar at a healthy level. And recording your blood sugar results every time you take your blood sugar, and take appropriate action as a result of the immediate blood sugar results. This plan of action should be discussed with your doctor. Some more ways to keep your diabetes under control is to eat a healthy diet and maintain a healthy weight. Exercise regularly. Walking is considered a wonderful exercise, and you should be working toward walking or some other form of cardio exercise at least 30 minutes a day. And see your doctor regularly to monitor for any complications. Eating healthy is the beginning, and here is an example of the United States government's plan called My Plate. When you choose My Plate, you're choosing to eat vegetables as the largest portion of all of your foods. Fruits, also fiber-rich especially, should comprise between the fruits and vegetables at least half of your meal. little bit more than a quarter of your meals should be grains, and again, the fiber-rich foods are the better grains. And slightly less than a quarter of your plate should be your protein foods. These could be beans or nuts or meats or eggs. A serving of dairy is part of the My Plate healthy eating plan, and that could be milk, or it could be a yogurt or a cottage cheese or a regular cheese. You want to look for the low-fat kind of dairy plot just because of the complications with diabetes and heart disease. All right, so we talked about diabetes, but there's this little thing out there called prediabetes. Let's talk about what it is. This is a condition that precedes diabetes and increases your likelihood of developing a type 2 diabetes. Blood sugar levels are higher than normal, but they're not really high enough to be diagnosed as a diabetic. You can have prediabetes and not even know it. People with a diagnosis of prediabetes can prevent or delay the onset of type 2 diabetes through lifestyle changes. Primary prevention, as measured in research clinical trials, is weight loss, regular exercise, and a healthy diet can lower the risk of type 2 diabetes significantly, even for people at high risk. So, an important fact, there is no such thing as borderline diabetes or just a touch of it. Prediabetes is a diagnosis. Some ways to keep your diabetes under control is having exams by your doctor. You need a dilated eye exam at least once a year. You need to see your dentist at least twice a year. You need to have your A1C measured, this is a blood test, at least every 3 months. You need to have your blood pressure checked every time you visit your doctor. You should be checked for kidney disease at least once a year. It's important to keep your cholesterol under control, and watching your fats, eating healthy fats more than the saturated fats will help with that. And getting a flu shot every year and a pneumonia shot as needed. If you smoke, stop. We can prevent type 2 diabetes in adults, and there are many, many, many years that precede the development of diabetes. Screenings can identify someone that's at high risk, and there are safe and effective interventions that can address or make changes to the risk factors. These include obesity, body fat distribution, and physical inactivity. All right, diabetes basics. How can we prevent type 2 diabetes? Start with a healthy diet. This will help you to control or reduce your weight. Eat 5 to 9 servings of fruit and vegetables every day. If this seems like a lot, start with where you are and add 1 more serving a day until you adjust to that, and then continue that plan. Cut down on your calories by reducing portion sizes. A 9-inch plate is the proper size for a meal plate. Cut down on your fat intake. Again, you're looking for only healthy fats to help you to metabolize your vitamins, and stay away from the saturated fats, the ones that are solid at room temperature. Keeping track of your progress really helps. all right? 30 minutes of physical activity on most days of the week. This can include walking or any physical activity that gets you up and gets moving almost all of your body parts simultaneously. Knowing your family's health history helps you to know if you're at risk or not. So check in with your family and see if there's a history of diabetes in your genetics. Check with your doctor if you show any of the symptoms of diabetes, especially an increase in thirst and urination. And ask your doctor if you should be tested for prediabetes. There are state resources to help you to control your diabetes. In the state of Delaware, we have the Delaware Diabetes Coalition Resource Guide. This will be given free to anyone that asks for it, and it will be handed out at our diabetes workshop at Dover Downs on November the 19th, and that's an all-day workshop with a free lunch. The Diabetes Self-Management Program, which I am the coordinator for, is a free 6-week class based on the Stanford University model, Diabetes Self-Management, and this is given throughout the state. It's a once-a-week class. It's a 2.5-hour workshop, and it's 6 weeks in a row. We also have emergency medical diabetes funds set up. These are funds available to people who, for one reason or another, are unable to afford their diabetes medications, services, and supplies. To qualify, you have to fill out an application with the Division of Social Services and make application at the Division of Social Services for these emergency funds. We also have on hand brochures, pamphlets, and cookbooks for people that are seeking to better control their diabetes. Throughout the year, and with the help of the Delaware Medical Reserve Corps, we have community blood screenings. The YMCA of Delaware is hosting a class called Change Today for a Healthier Future, and this is designated for people with prediabetes only, and this is a for-fee class that lasts about a year. And we have a library of resource centers with lots of different information available for anybody that needs it. Okay, so I've given you a whole lot of information, and I wonder if you guys are interested in quizzing to see if there's something that triggers for you that you can remember. So I'm going to go and ask you some questions. Before we do that, I'm just going to give you information so that you can contact us at the Delaware Division of Public Health, the Bureau of Chronic Disease, Diabetes, and Heart Disease Prevention and Control Program. We are located in the Thomas Collins Building, Suite number 10, and that's at 540 South DuPont Highway, Dover, Delaware, 19901. The phone number to reach us is 302-744-1177. And we do have a fax line, 302-739-2544. Okay, let's try this quiz thing. Can anybody name 2 symptoms of diabetes? You can type it into the chat, I guess, or raise your hand. July?
Let me see here. July, it looks like your microphone's enabled if you had an answer or comment.
July, can you tell me 2 symptoms of diabetes? Anybody else out there? Okay. I'll give you the freebie answer if you want. All right. 2 symptoms of diabetes. Well, you might be really thirsty. You might feel like you have to go to the bathroom frequently, way more frequently than normal. You might experience a weight gain or loss that's unexplained. You might have some blurry vision or feel tired or like you have the flu, even when you don't. You might have slow healing wounds or numbers of infections that kind of just seem to happen frequently. You might experience some numbness, especially in your extremities, fingers, toes, feet, legs. If around your teeth you have red and swollen and tender gums, that's a symptom. You might have drowsiness at unexplained times. You might have high blood sugar, but you probably won't know that unless you happen to check it. And you might experience or see some acanthosis nigrus, which is the thickening and darkening of skin to skin touching places, most commonly around the neck, at the back of the neck. All right. July, I love the fact that you tried to raise your hand and answer, so you get points. Let's try the next question. All right. What is a fasting plasma glucose range that is considered pre-diabetic? Now, again, this is a blood test, so you got to go deal with the lady with the needle. And it's fasting, which means that you can't eat for 8 hours before you get this blood test, so it's a little bit like the cholesterol test. Does anybody remember from the presentation what the numbers might be, milligrams per deciliter? All right. I'll give you the free cheat sheet answer. A fasting plasma glucose range is considered pre-diabetic when it is between 100 to 125 milligrams per deciliter. And again, you probably won't know that unless you have that blood test taken at your doctor's office or at the lab. All right, the next quiz question. This is my favorite question.
You can always change your diet, lose some weight.
Absolutely. Changing your diet and eating right is a true preventative measure. We talked about body fat proportion to your body. The truncal obesity, or the obesity that you find most commonly around the middle of your waist, is probably the most problematic. Another thing that you can do that really prevents diabetes from happening is to exercise. Exercising 30 minutes most days of the week is something that can really help to prevent diabetes. Exercising can be as simple as getting up and taking a walk. If walking is a challenge for you, start out by just walking for a few steps for a few moments and then increasing it just a little tiny bit each and every day. There's no reason why you have to do all 30 minutes of walking at one time. Sometimes the most walking you can do for one moment is a couple of minutes, so 5 minutes at a time, and then do that 6 times a day. If you can walk for 10 minutes, do it 3 times a day. If you can walk for 15 minutes, do it twice a day. And if you can get out there for a good 30-minute walk, well, that's almost a whole mile, so you've got me beat. Go for it. The next question is one of the risk factors. Does anybody know one of the risk factors for diabetes? It's one that we all have.
People responding on chat. Let's see.
Oh, good. Yay. Yes, one of the risk factors is family history. Thank you, July. And one of the complications is eye disease. Thank you, Stephen. I love that I just found this chat. Fantastic. Some of the other risk factors are age, and we all get there eventually, we hope, 45 or older, and minority status. There is a higher prevalence of diabetes for people of the Native American status and of the Latino status and of the Asian American status and of the African American status, just slightly. So we really want to make sure that we do a generalized preventative plan for everybody and offer services where they can best be reached. July has a question. Why is there a higher prevalence with the minority groups? July, that's a really good question. I think there's a genetic component to that as well as a sociological component, meaning that traditional diets, traditional life experiences may lend themselves to a higher prevalence. There's also a question about health access. I have with me one of the volunteers that teaches my program, and she's writing me a note, and she says it's harder for people that have lower health care access for them to catch the symptoms early and get a diagnosis and get treatment early. So thank you for asking that question, July. Does anybody else have any other generic or generalized questions now that I have some backup support with my volunteer leaders here?
Yeah, I had a question, Charlie in Connecticut.
Hi, Charlie.
Hi. Do you have a ratio of when somebody develops a CKD, do you have the ratio of who's diabetic, who gets it from high blood pressure, who gets it from a mixture of the two? Mine came from a mixture of the two. Do you have any ratio on that?
Okay, so your question is there a ratio on who gets diabetes from, and what were the two places that you suggested?
Oh, no. What I'm asking is if chronic kidney failure is developed through diabetes, high blood pressure, do you have a ratio of, coming from diabetes, coming from high blood pressure, a mixture of the two? Is there any numbers you have on where it's coming from?
I don't have that kind of research. That is a really good question. I can't answer that today, but you could email that question to me, and I could do the research for you and try to get back to you. Or you could connect, and I'm going to go back up on my slides, or you could connect to me by phone. There we go. So this is my contact information, 302-744-1177. And my email is my name. It's Wendy, W-E-N-D-Y, .Bailey, B-A-I-L-E-Y, at state, S-T-A-T-E, .de for Delaware, .us.
Now, just one other thing, Wendy. Where do you see this going in the future? And I try to tell people that, we're going to see numbers of people developing kidney failure that are going to double and triple in the next 20 years. Am I accurate with my statements? where are things going in the future?
Well, the one thing that we know is that diabetes and diabetes management and self-management is a critical component for all health care. People with diabetes, the complications are devastating. I realize this is a dialysis patient program. I know that kidney failure is a connection to diabetes in a large way. I'm not absolutely certain which came first, but my guess is that both of those conditions, if we don't get a handle on preventing and promoting positive health choices and management for those conditions, we're going to see a larger and larger population experiencing them. That was kind of a generic answer, wasn't it?
Yeah, well, and I think too, also with kids in the school systems, if they're not brought up the right way, yeah, I know I don't have to eat everything healthy at a young age, but if they're not at least given some awareness of these types of foods, I mean, this is where it starts, and you can only see really bad things up the road if education is not out there, for people to learn more.
You're absolutely right. You're talking to a retired school counselor, and I have continuously, throughout my entire professional career, speak highly to kids need more physical education. They need more opportunity to move and be active. They need more opportunity and access to health information and health care. In Delaware, we've managed to put wellness centers in almost every one of our high schools, which is a good start, but we really need to hit those elementary schools with what is primary prevention, what is good, healthy living. So thank you so much for that question. Touched my heart. All right. Well, we're at 3:35. Any final questions or anything?
I actually have a question about recording. For those who are current diabetics, do you suggest or see any difference between those who just rely on their testers to record their sugars or potentially actually physically writing it down each time they test? Because I know now those testers can store a ton of information.
Well, I bought my son the Apple iPhone tester recorder, and he broke it as a typical high school student. It fell in the toilet. So I always recommend that people have, a backup plan. Monitoring and recording your blood sugars on a regular basis is hugely an important part of managing and getting good treatment, talking to your doctor about, what your patterns are and another thing to note is that your doctor is, the best resource for all of your immediate personal kinds of this is happening to me kinds of questions, but there are other healthcare providers that can be a support, your diabetes educator, your physician's assistant, and other, your endocrinologist are all, good people to check in with and be a part of your diabetes healthcare team. I am checking on my chat board, And I would like to say thank you to Anna and to Rose and to July. July Rose, that's a beautiful name. To Stephen and to Charlie for chiming in and asking questions. I appreciate everybody's time and attention this afternoon. And you are welcome, again, to email me if you have any more questions or you'd like to get more information. My email, again, is Wendy, W-E-N-D-Y, .Bailey, B-A-I-L-E-Y, at state, S-T-A-T-E, .de.us. And at this time, I'd like to say thank you very much, and I hope you all have a wonderful rest of your afternoon.
Thank you so much, Wendy, for joining us.
You're welcome.
If there are any last-minute questions, feel free. But again, Wendy gave you her contact information. If you didn't get a chance, you could always shoot me an email, and I can get it over to her. So thank you all for joining, and thank you, Wendy, for taking the time out today. I really appreciate it, and I know the patients do as well.
Thank you. Have a wonderful day.
Thank you.
Thanks, Charlie.
Thank you.
Bye-bye.